일반적인 틀니를 착용하게 되면 이야기하거나 미소를 지을 때 분리될 수 있습니다. 하지만 Simply Natural Denture와 같은 보철물을 사용하게 되면 이러한 문제가 생기지 않아 환자분들은 안심하고 이 보철물을 사용할 수 있게 됩니다. Simply Natural Denture는 치아 형태와 자연 치아들의 신미성을 모방한 보철물입니다. 그리고 최대한의 맞춤성을 위해 특별하게 가공되었습니다. 이 Simply Natural Denture에 대해 좀 더 자세히 알아보도록 하겠습니다.
Robert, I know you're here for new dentures, but I need to ask you a few questions about your old ones.
Sure.
How long have you been wearing your present dentures?
About 40 years.
What would you like to change most about your dentures?
Well, my daughter brought up the point that when I smile, you can't see my teeth. And I don't know if that's the dentures or not, but I think it probably is.
Do you have any problems eating or chewing?
I have problems with like hard things like apple, or biting corn on the cob, or even chewing steak sometimes.
Are you happy with the color and shape of your teeth?
I don't know anything about shape, but in regards to color, I smoked a pipe for many, many years. And the nicotine's made the teeth darker, so I like to have them lighter if possible.
Okay, Robert, let's take some impressions. Okay, Robert, how do you like this setup, Tryon?
Well, I really like the teeth, but they look too perfect. Is there something we can do that make them look a little more natural for my age?
Well, yes, there is, Robert. We can use a more characterized premium tooth, and we can also rotate them a little bit to make them look more natural. Okay, Robert, these are going to feel different than your other dentures. How do you like them?
These are terrific. They look so natural, they really do. And they even make me look younger, I think.
만약 여러 자연 치아들이 손상되었다면 치과 의사분은 Simply Natural Partial을 처방할 수도 있습니다. 이 보철물은 다른 브랜드보다 더 자연스럽게 보이고요. 매일매일 착용할 수 있게 됩니다.
Simply Natural Partial의 편리함과 자연적인 모양을 향상하기 위해 좀 더 신미적인 클래스프를 요청할 수도 있습니다. 추가적으로 치과 의사가 어태치먼트를 요구할 수 있습니다. 이렇게 하게 되면 보철물의 강도성이 더 높아지게 됩니다.
Phil, as you know, we've already gone over the examination with you at a different time. What I did is I went over your entire dentition. I checked for any type of malocclusions you may have had, which you didn't. Your teeth look excellent. You've already had several sessions with our hygienist. Your gums look excellent. They're in wonderful form. Your bone is very strong. I'm very confident that whatever we put in your mouth will be able to hold real tightly for you. You don't have any teeth that are overhanging. You don't have any what we call collapsed jaws. Everything looks real good in your mouth. So now we're ready to begin the different type of options that we may be able to place in your mouth to replace those missing teeth. I need to tell you all the different options. First of all, we can do nothing at all.
No, but I'm losing my teeth. I have to do something.
Yeah, I didn't think that'd be an option for you.
Right.
Another option that I need to share with you is implants. Implants is a surgical technique where we would actually surgically place implants in your mouth, and after several months of making sure that the bone attaches tight to the implants, then we can place teeth on those implants.
Yeah, I don't think I want to go through the time element implant.
Okay. Another option is doing with a fixed bridge. However, if I did that, I would have to grind pretty significantly on two of your teeth that are very good and very strong right now.
I don't really think I want to lose any of my present teeth that I have.
As far as any tooth structure.
Grinding, right.
Grinding, okay. Then our other option, which is still an excellent option, is to make a removable partial denture in your mouth. All right, that's something you would remove, you would take in and out. Would you be interested in something like that?
Yes, that's what I'm really in here for, is to improve my partial that I have.
Okay, because you're used to that already.
Right.
Okay. Philip, now that we've decided on a removable partial denture for you, what would you like to change most about your existing partial?
I'd like to have the metal hooks removed from the front of the teeth. Every time I smile, they are too obvious.
Explain the comfort and fit of your existing partial. Is there anything we can do to help that?
The thickness of the metal in the back that fits against the roof prevents me from speaking, and I'd like to have it cut away or whatever you guys do.
What we can do for you is, you mentioned to me that you want to get rid of that thickness in the back of the mouth, and also get rid of the dark hooks up here in the front. We can help. We can help you with those options. What I'd like to do today, let's go ahead and get started. And what we'll do is we're going to take some preliminary impressions, some molds of your mouth. I'll send those to the laboratory, and then they can do some preliminary treatment options or preliminary design options for us, so we can decide which option would be best in your case.
All right.
All right, Philip, I've received our models back from the laboratory. And what we're going to use here, I remember you mentioned you didn't want any clasps showing in the front, and also you wanted a thinner area on your palate so you could speak better. So what the laboratory has designed is a rotational path design, where I'm going to have to modify these teeth just a little bit, so when we place the partial in your mouth, it's going to go into the front area and then rotate into the back teeth, which will actually hold the partial in. But the front will still be locked in because of the rotational path design. After some slight modifications to your teeth, we can go ahead and begin now and take your final impressions for your partials. Receive the teeth back from the laboratory. Now, these teeth are set in wax, so you have to be real careful when I place these in your mouth. The teeth can break off easily. So what we're going to do is I'm going to take these off the model, I'm going to place them in your mouth, and I want you to see how you like them. I want the way the teeth are set up, if your bite is correct, and your smile line. I just want to see how you feel with these in your mouth and the teeth in this particular position.
Okay.
Okay?
Thank you.
All right. Okay, now carefully bite down. Then I want you to let me know how they feel. Run your lips across the top of them.
Feel very nice.
Okay, Phil, let's look in the mirror now, and I want you to tell me how you feel the teeth look.
Is there any way that we can get a more natural look out of the teeth, color-wise?
Yes, I think so. There's a premium tooth that we could use in your final partial that I think will brighten up the partial quite a bit and give you what you want. Okay, Philip, we've placed your new partials in the mouth. I've used pressure indication paste to check for any sore spots, and I've adjusted your bite. I've showed you how to take your partials in and out and how to maintain them. How do you like your new Simply Natural partials?
They look great, Doctor.
They look very natural. I'm very pleased with that.
Thank you.
이분이 원하셨던 대로 저희는 프리미엄 덴처 치아들을 사용했고, 그래서 더 자연스러운 틀니를 만들 수 있었습니다. 만약 Simply Natural 파셜에 대한 질문이 있으시면 담당 치과 의사분과 상의하시기 바랍니다.